around equivalence, because not all radiation is the same, but we give different doses. So I'll just read a couple out because you won't write it down, you can read that. But it's sort of the equivalent. This slide just says what the things are. So we've got the top one about eating a banana, and it's the equivalent of just 20 minutes of just existing from the background radiation you get. And the risk of cancer is 1 in a few million. Whereas if we come a little bit further down, we've got a flight to Hong Kong in the middle. That's equivalent to about a week's radiation. And then a bit more risky than that, we've got a pelvis X-ray. It's about 1.5 months radiation of just existing. So you see, the more of these you have, the more radiation you're almost building up. Again, CT heads, even higher. And again, CT chest anti-pelvis, that's 4.5 years equivalent of background radiation. So the more radiation you're having, the worse it is, basically. So try and keep it as low as possible. Next slide, please. So this is a little bit about how X-rays are produced in theatre. If you just have it 2 more times, probably. So this is your typical X-ray tube. In fact, I think this is what you guys have here. So that's what this bit at the bottom of the X-ray tube, that's where the radiation, the X-rays are coming out. And this bit at the top, what we call the II, the image intensifier, that's what captures the X-rays and produces the lovely images that the doctors can use to work out what's going on in the operation. So radiation comes from here. So in this picture, it's coming from the top, comes down. So that's what we call a primary beam. So if you think wherever the position of your C arm is, if this is facing you, directly you're in the primary beam of the strongest radiation. So as much as possible, if you can, step out of that. Because any distance, I'll go on to that again in a minute, any distance away from that will be beneficial. So you have to think about the primary beam and then scatter that comes off that. So scatter is when the radiation hits something and then bounces off. It will be reduced because whatever it's hit has absorbed that radiation, and then it bounces off. So the patient, it will bounce off each other, the instruments. We used to think about putting lead gowns on patients in theatre, but what that can do is the radiation that gets inside then just bounces in and out because it can't escape through the lead shielding that we've put around the patient, so it can bounce around. So we try not to do that if we can help it. Next slide, please. So the 3 main ways to keep your dose as low as possible is time, distance, and shielding. Time, so again, that's the amount of time you're having to press the button and expose, or if you need to do a live to see how the joint's going or how the fracture's looking, try and keep that as low as possible. Surgeons, if you're asking us to do it live, remember to tell us when to stop, because sometimes you just carry on and we're just still there with our finger on the button exposing everyone, including yourself. So try and remember to ask us to stop. Radiographers, try and be observant. If it looks like they're no longer looking at the screen, take your finger off the button. And again, just with the amount of exposure you're taking. Another thing is, we're going to what? Can you just next slide, sorry. So yeah, again, with time, if you don't need to be in theatre, don't be in theatre as much as possible. I appreciate this week there's a lot of teaching going on, so there is a bit of necessity to be there, but when there's not, just sort of step outside if you can. Next slide, please. So the other one is distance. There's a very technical thing called the inverse square law. I'm not going to go into in great detail. What it basically means is the further away from the source you are, your dose just keeps shrinking a lot more. So as far away as you can is good. We usually say if you're 2 meters away, you're doing fine. But yeah, if you can, the further away you can get, the better. Next slide, please. Shielding. So there's a few ways of doing this. Obviously the lead gowns that we've got, or stand behind sort of doors. Preferably don't just all stand there right behind the door ready to come in, but luckily where, at least in theatre, this theatre here, the main theatre, the doors are usually far enough away from the table, so you've got your distance and your shielding, so that's really good there. Again, if you can, fire a shield if you're right next to the beam is sort of beneficial, if possible. Next slide, please. And then the last one. Yes, so the other thing I should say about leads, I have condemned one here. The lead should be 0.35 millimetres equivalent. It says on the labels, not very clearly, because some of the labels are very well used, but it should say 0.35. Sometimes there's ones that are 0.25. They're fine to wear in the X-ray room if you're like holding a patient or something like that, that's fine. But in theatre we need them to be 0.35 equivalent. They also need to cover sort of from shoulders to kind of mid thighs, and they need to do up all the way. You can't have ones that don't do up. Ones that cross over, you need to cross over properly, because quite often they have half the lead equivalent in each side, so so it's only fully protective once they're fully covered over like that. You can't, especially like you think when you're sitting down, if you're sort of sitting down in theatre and then they all gape open, again that's doing nothing for you. So you need to make sure you're fully covered up, otherwise you might as well not be wearing it. Next slide, please. Another thing to note with leads is if you look after your leads, they will look after you. Sorry, they will look after you. You need to respect them, because you know they will break. You need to make sure you hang them up or leave them out flat. Do not just take them off, dump them on a chair, because the more they crease, the more they crack. And when they crack, there's a gap that the radiation is going to get through, and they will not be protected anymore. So yeah, always hang your aprons up. Always make sure that they're sort of fastened up. Clean them. Just basically look after them. And as much as possible, kind of avoid sitting down in the aprons and just getting them creasing, folding. Don't bleach them. Don't sort of wash them in a washing machine. I'd like to see someone try and put them in a washing machine. And try not to leave sharp objects in your pockets, because that can again puncture the lead, and yeah, don't fold them. Next slide. So this is an example of a lead that's been sort of used over the years, overused. This may be fine. It's hard to tell because this is just the outer cover that's got the cracks. It's the lead underneath. So at home we usually, I say we, I've never done it, but screen our leads to check for holes. So I might chat to one of my colleagues and see how they do that, and have a look at these aprons and see if they're actually doing any good or not, because if they're just full of holes, then it might be worth seeing if we can find an alternative or something, because if they're full of holes, then they're not doing any good. And then you're thinking you're protected when actually you're not. Next slide, please. So yeah, a few take-home points. Only people who should be in theatre, well yeah, people who need to be there should stay there. If not, then try not to be in there. Don't know if I've put this on here, but if there's any chance you think you're pregnant, then just be really mindful. Again, if you can avoid going to theatre, then that's fine. It is safe to be there while pregnant. Just make sure you are fully gowned up to keep things safe. Don't expose any parts of your body in the primary beam. That's another thing to think, sorry. Surgeons, be mindful where you're putting your hands when taken for the x-ray. Radiographers, keep an eye on the screen and your surgeons, because they're obviously busy thinking of a lot of different things, trying to, you know, save a person's limb or whatever. Last thing they're thinking of is where exactly they're putting their hands. So if you can see some fingers in the last shot and you think they've not moved their hand since, just politely say, you know, can you move your hand, or like your hand's going to be in the x-ray, and they'll soon move their hand because they don't want to keep x-ray in their hands. But yeah, just look after your aprons, keep your time to a minimum, stand as far away as possible, and yeah, be aware of your surroundings. The other thing to say is, obviously we don't have lots of lead gowns here, and that theatre, people sort of walking through, if someone's shouting x-ray at you, usually means they're about to take an x-ray, so don't come in the room unless it's really, really necessary, but just sort of vocally say that so they're not pressing that button. Communication's key, basically. So yeah, I've given you these little quizzes. Have a look through. I'm not going to mark anyone, it's just for your own knowledge. Hopefully you've covered most of it within that. But I'll just go through the answers anyway, so you're not wondering. So the first question, radio waves, are they as dangerous as x-rays? Does anyone have an answer? False. I can only receive radiation if I have an X-ray. False. There is a safe dose of radiation you can receive without any risk to your health. False. Okay. Which of the below effects is not an effect of radiation? Unfortunately, well, I left Glorious on there by now. Only women of childbearing age should be concerned about receiving radiation. Oh, on that point, any female between 12 and 55, where you're doing something from sort of, we always say kind of like nipples to knees, you need to be aware of, you know, see if there's any chance of pregnancy. So if you're doing like a DHS, for example, on a 30-year-old, you need to exclude pregnancy before going ahead and see if there's any other alternatives. Next question. We can put these in the order of risk of radiation to go from low to high. What's the lowest one, do you think? Yeah. Second lowest? Third lowest? Yeah, and then the worst is CT, chest, abdomen, pelvis. 7, only X-ray C-arm produces X-rays. Or a mixed X-ray. False, yeah, so you can get scatter off everything else, so just be mindful of that. Standing behind the door detecting radiation. It's a bit of a trick question. It will help, there's a bit of shielding. And here is fine because they are sort of far enough away. The more you can get between the better, but I'm pretty sure these doors are not lead lined, so they're not the ideal. As we have in most of our fixed at home, they're not lead lined. Is it important to store your leads carefully? Yes, true. And then finally, what are the 3 things you can do to reduce your radiation dose? Lovely. Yes, exactly. So that's all I've got to say. Thank you very, very much. Does anyone have any questions? Technically, yes. Most. You probably don't. I mean, so if we go back to the first slide, if possible. If not, then I'll just hold this. So this is where the X-rays are coming out from. So theoretically, most of the time, that should be at the bottom. So by the time it gets up to you, that is a lower dose of radiation. Maybe if you're doing something where it's directly aimed at you, potentially, but most of the time, like DHS, that's more aimed at me, so you're okay there. But I don't tend to wear one. Some people, you ask me to say, yes, you should wear one. But
interventional radiology, my colleagues consider thyroid to be a self-inflicted injury.
But their screening times are much.
Oh, no, they are.
Yeah.
They're a lot longer, but the fact remains.
Yeah, technically yes, you should wear one, but you know yes.
Can I just ask another question about using the image as a table? So there was practice in some hospitals in the UK. So if you're doing a wrist fracture, instead of using an arm table in theatre, you would rest the arm.
So yeah, what you do is you flip this the other way up,
and people would use. People would use K-wires.
So I'd say I'm happy for people to do it, but when it starts getting to K-wires, it's a big no-no, because as soon as you puncture this, you've broken the whole thing, basically.
But also affects your life.
Yeah, well, so the radiation is coming out this end,
yeah.
So it's not so much as that, but I mean, you might electrocute yourself.
Yeah.
There's a lot of electricity coming into this machine. But yeah, it's a big no-no using that for taking especially sort of controls and K-wires over a hero. Yes, basically. If you may be doing just a little manipulation, potentially, you get away with it. And also you don't want to put too much pressure on it either, because there's a lot of load going on a very small area there, and you don't want to break it.
And the cost of the machine is expensive.
Oh, yeah, a lot.
3 or 4 machines.
Yeah, I wouldn't very, very expensive.
Yeah, on my lease program, yes, we have lots of problems with insurance. Now we are lucky because we are a good lease program, certainly these are expensive things. So we take care of them and we do it.
So if you look after your equipment, they'll look after you.
And thinking for a presentation, they used to show about 6 meters and the surprise is 2 meters when you say this. And also the issue of the difference between them and the chest span. And the other issue of what's it called?
So this is lower dose, hence why the quality is not as good. This is a lower dose exposure. I don't have the equivalents. I mean, it's hard to do an equivalent because every case is different on this one. Like sometimes you might press the button twice, sometimes you press it 20 times. Just try and minimise it as much as possible, basically. But the image, each exposure is a lower dose. Then, so if you're doing an ankle, and then exposure of your ankle in here is a lower dose than it is in the X-ray room, hence why the quality is not great.
It's standing behind, you don't have the motion, and somebody's in here. I stand behind somebody to shoot.
Yeah, it's not gold standard practice. It's not best case because there's a lot of human error involved with that. You're paying, people are scattered all over the room. The radiographer has to make sure you're definitely behind the person. It's easy to just step out with that person just to move away and they press it and then you're not protected. If worst case scenario you sort of need to do like 1 or 2, maybe again it's not best practice, but it is protecting you because you are shielded technically. But yeah, the best practice is to leave the room if possible. I understand it's not always possible, and definitely the distance. So if in that situation, the further you stand back and you're shielded from a person, then that's better than sort of standing right next to the source being shielded. So yeah, it's not ideal, but it is better than not standing behind a leathered person. Anyone else got any questions? No? Thank you. Have a lovely day.